Hey guys, Josh right here, and today I'm going to show you how to use this on your knee. Okay, the first thing that we have to do is we have to grab ourselves some nice skin, as we have here. The areas then that I'm going to focus on with my Gua Sha tool, which is a stick-on sickle shape one. I think it's the most versatile one. As I'm going to focus here down on the lower portion of the quads where it connects into the knee. I'm probably going to hit up a little bit out here on the side where the IT band comes down and attaches to the outside of the knee, and a little bit on the inside of the knee where the adductors and the popular VMO come to the knee. I may hit up my patellar tendon. I do not know yet if it needs it, but I'm going to start off right here on that further down portion of the quad. So I'm going to start off light, just like I would anywhere else in the body. I'm kind of checking for areas that are a little bit tender, even with a light pressure. And then I'm going to go to the inside, check out a little bit. Nothing major there, at least right now. The biggie that I'm seeing is right here, down where that rectus femoris comes down. It grabs onto that patella. So that's where I'm going to dive right into. I like to go either direction, away from me or towards you guys, or back towards me and away from you guys. Honestly, I just go whatever direction's easier for my hands. Pushing away seems to be easier for me. So that's what I go with. But one of the biggies that I look for when I find an area that's tender is I will work that area until a good bit of that pain and discomfort from the tool has dissipated. No different than if you're using a lacrosse ball to try to lean on against a sore muscle. Is you feel it on that muscle and you're like, dang, that is killing me. And then once that pain starts to really dissipate as you're leaning into that ball, then you can be done. That's the same idea as this, except for using the Gua Sha tool. So as I go through right here, kind of this diagonal is giving me a bit more problems than even going straight down. So I'm going to focus right through there. And I can even see where, I can feel a knot, but I can see where that petechiae is starting to show up on that quad. And in this situation, that area right there where that petechiae is does correlate to an area that's very tender. Sometimes it does, sometimes it does not. So as I'm working that area, I'm gradually increasing pressure. And then now a good bit of that pain and discomfort has dissipated, so I'm going to move on. So now I'm going to go to the outside of the knee, kind of check it out. This is a very common spot for folks, right here where that IT band comes down and inserts. That's super common. I'm not really feeling much on me, but for demonstration purposes, I'll show you what it looks like. And how I know it's not really that bad on me is I can put quite a bit of pressure on it right away and it really doesn't bother me. But if it did bother me, one of the common spots is right through there and then up a little higher on the IT band. But you'd start off light, find an area, say, oh, that hurts. So then I would kind of focus and isolate the tool right there in that area. And I'd go through that same process of it's tender. I'd work the area till the tenderness kind of dissipates. Then I may increase a little bit of pressure and then repeat. But again, I'm not really feeling that much right through there right now. Sometimes I do, sometimes I don't. So now I'm going to go to the inside of the knee. And initially on the inside of the knee with that light pressure, I really didn't feel much. So I'm going to go to a deeper pressure. And With that deeper pressure, I can feel right there on that VMO. That is wanting some work. That's what I love about this sickle-shaped one, is I can use two hands, because the amount of pressure that I'd have to use for the quads, much bigger, denser muscles, it's quite hard with one. It really fatigues your hands out. But with the sickle one, you can use two. But yeah, even as I'm using that increased pressure on it, I can feel that it did need it. And that's not an area that I was feeling on my knee. Really on my knee, I was kind of feeling up here before, even before I started this, I was feeling some just tension, a pull through here. I was not feeling anything at all over here on that VMO. Sneaky little booger. So I'm going to go through that same process. I'm going to work that area at a certain pressure until a good bit of that discomfort has dissipated. And once it dissipates a good bit, I can move on. And again, I could go through that, I could go with that pulling motion, but it just doesn't seem to be as effective for me as that pushing motion. So a good bit of that bite has dissipated, so it's going to be time to move on. The next area that I'm going to check out is that patellar tendon right through there. It's where the doctor comes in and gives you a whack on the knee, checks your reflexes. But this is a very common spot for patellar tendinitis. So it's a very small area. It's a very dense tendon, but it's not very large. So I don't have to really scan a whole lot of the area. But I'm going to start off nice and light. Checking. Nothing significant there. So I'm going to add a little bit of pressure. Nothing major. The most major thing I actually feel is right there on that inside portion, the medial portion of that patellar tendon, right through there. So I'm going to hit that up. A little bit right there at the bottom. Doing the gua sha on the knees is probably one of my most favorite places to do it on folks, because it's such a drastic change. They come in and have pain with squatting, kneeling, running, going up and down stairs. You do this and it just gushes blood flow in there, and then they go to squat, get down on their knee, and they cannot find that pain. Instant gratification. But there wasn't much in there, but it was worthy of getting. And now most of that discomfort has dissipated. So any other areas? Now when I go over bone, I'm not using near the pressure. It's almost like shaving a balloon. It's just real light. There is no major muscle group here. Just skin, fascia, some ligaments. But I'm not feeling anything over there. So the biggies that I felt it today were here on part of that rectus femoris as it comes down. That was a big spot. VMO was kind of a hidden little area, and then did a demonstration on kind of that connecting portion of the IT band, that distal IT band, and the patellar tendon. But this is how I would do Gua Sha on the knee. Okay, so in today's video, I showed you how I use Gua Sha on my own knee and the things that I look for. Some of the diagnoses that these would be good for would be patellofemoral pain syndrome, patellar tendinitis, quadriceps tendinitis, IT band syndrome. Any of those I use on my clients all the time. It's very effective, it's quick, and it just helps with the recovery process. Along with a lot of other modalities, this I feel like is a very key thing to get people back to where they need to be. If you guys have any requests of anything that you would like to be seen for me to post demonstration-wise on Gua Sha, I'd be more than happy to do it. Just let me know. Thanks.